Welcome to the Healthy Communities Collaborative for America. I'm Michael Knowles with the Health Futures Group. We're coming to you from the National Defense University in Fort McNair in Washington, D.C. The Health Futures Group is a network of leaders across the United States Health Services, including the Department of Defense, Health and Human Services, the Veteran Administration, and the Public Health Service, inspired by a vision of health as a national strategic imperative. Join us today in an epic campaign for national health, wellness, and resilience. We're going to be talking about a few things today. One is we're going to be reuniting the top teams from Roundtable 3 and some honored guests that are with us today. We're going to be reviewing ideas in action from Roundtable 3. We're going to launch the Healthy Communities Collaborative for America, the HCCA, outline the HCC concept and approach. And we're going to give you some questions to run on and ask you for feedback as we're working through the program here. A little housekeeping. You can see in the GoToWebinar control panel, there is the ability for you to raise your hand. By doing that, I'll get a notification that you would like to ask a question via audio. If you want to just type a question in, you can do so in the questions section of the GoToWebinar control panel. Click the send button. I'll see the question and be able to pass that along to our presenter. Questions to run on for the day. So as you're participating and watching this webinar, here's some questions to think about. What are you hearing that inspires you to lead with a new focus on the Roundtable's call to action for health and resilience? Who, what, where are the leading practices and models that work for the health determinants you care most about? What specific actions will you take by next Tuesday to be a part of this ongoing journey? Now, you've got the webinar worksheet as part of the invitation. It's a tool you can use as moving through to record your thoughts. You can see the first column here. We've listed the questions to run on. What am I hearing that inspires me to action? Where are the high-performing innovators? Which communities of solution are within my reach to lead or influence? And what will I do by next Tuesday to be in action? Use the second column there to record your first reactions, bold thoughts that may occur to you during the process of the webinar, and your own strategic next steps. We'll be asking for feedback on these as we walk through the program. Would love to get your feedback and hear your thoughts. Now, without further ado, I'd like to introduce our presenter today, Dr. Mark Loafman, who is one of our Health Futures Group members. He's also the lead of the Patient Safety Clinical Pharmacy Collaborative and on the faculty at Northwestern Feinberg School of Medicine. Without further ado, Mark?
Michael, thanks for the warm-up and the welcome and the great job of framing the day and what we're going to be talking about today. It's going to be a great conversation. We're looking forward to sharing with you ideas that many of you have been active in planning and prepping for as we move forward. But it's a serious subject, but a hopeful plan and fitting the aspirational model that the Health Futures Group at NDU has been so effective in coining and bringing forward with us today. So we're going to talk a lot about why, what, and how. So really the why, an awareness of our current state, it's troubling. It does create a sense of urgency on our part. So there are multiple epidemic scale crises going on at many levels, both locally, nationally, and internationally, and all at the same time, happening together. So there's a sense of things ready to boil over, and our capacity to manage that is clearly challenged. We're going to look at the why and what and how across three levels as we run through the webinar today. At the individual and family level, we're well aware that physical, emotional, and financial well-being is strapped and stressed to the point that we do not have reserve in many of our communities. We're not able to have the resilience necessary to cope and move forward. At the community level, our education systems are struggling. Jobs are a challenge. The inequalities, racial, ethnic, and social inequalities that have long been a goal to remove from our country are still plaguing us and in some ways are getting worse. Housing is an issue. at the national level. In summary, really, we suffer too much, we spend too much, and die too young. And those are not judgment calls. Those are the hard, cold facts when we compare ourselves to other developing and developed countries. All this together means there's a lack of resilience that threatens our security as a nation and threatens our capacity to respond, our capacity to improve and grow. That's the why. And knowing this is true, knowing that we can do something about it is a call to action. So what then that comes out of the aspiration is really what shaped the trajectory of the mission and vision that Health Futures Group has established. So the vision, as you can see here, is an aspirational future looking at a secure, prosperous, and economically stable nation, achieving that not through fixing people, but through getting to optimal health and well-being. That creates a mission and really a whole-of-nation health enterprise. We know this can be done through collaboration and community engagement. We're going to talk today about the dual parallel strategy of both certainly a national campaign, a top-down campaign, but the very important ground-up community-based collaborative effort that builds, that's able to disseminate and achieve goals there. This creates an imperative, really. It's a national security imperative. So the health and resilience of our nation is sort of a priority right now to create the secure nation that we all want and need. So getting to health and resilience now, Health Futures Group has coined the phrase and sort of walked away with the charge of from healthcare to health. But really, we know that means that we want health and resilience now. We're going to use a couple of metaphors and images today about launching and about community subterranean and growth of communities of solution. But we're going to start right now thinking about launch. So let's launch this collaborative and let's get rolling. So how? So we talked about the why, the what, and the how. There's an aspirational and agile model. That's what's required. It's about a collaborative process with learning and action. And we kind of know the hard way that learning by itself creates an aspiration and awareness that we can do it, but without that action, change does not happen. And action that's not guided by what the best practices are leaves us burning and churning and wasting resources. So really, to get the resilience that our nation deserves and can have, it has to be a combination of learning and action. What gets in the way? Well, we tend to get overwhelmed with circumstances, behaviors. We feel like a hamster on the wheel, just churning and churning. We're overwhelmed. The problems are too big. The culture's too entranced for change, and we feel helpless. And it puts us in this exhaust cloud of rationalization, blame, and justification. And it's 80% of us, statistically, psychologically, tend to get caught up in a reactive negative perception. That's our culture. That's our style. We want to break out of that with an aspirations model. What does that look like? Really reframing, moving positive. I can, I am, we are, we will. It's a way to say, do, and think. It's corrective, and it does get more. You get more of what you focus on. So this is one core principle Health Futures Group is using to launch this collaborative, is the aspirations model. Secondly, it's complex. There's multiple levels to make change. So it's about the why, which informs the what and informs the how in a cycle back and forth. But all of these have a strategic, an operational, and a tactical level at which they work. So look at the complexity of this, and it's no wonder that we get stuck sometimes trying to churn and burn and get through. So changing the culture through a learning process and then embedding that through practices gets us the outcomes we want. All of that work, several years now at the Health Futures Group, has led to a word salad here of some pretty powerful concepts that come together. So obviously health at the middle, but you can see community, you can see policy, you can see goals, and the idea of an epic campaign where national resilience is there, at state level resources, we're talking wellness and outcomes. These are the right words, the right things. Bringing them together is what the Health Futures Group is all about. The debate graph that you see here, another word salad. These are all ideas, opportunities, best practices, communities of solution on debate graph. You can see here the National Defense University, Lincoln Hall, and here's Roundtable 3 and our own Colonel Masterson listening in as speakers present and warming up the audience and getting ready for our last roundtable. So that's the frame, that's the background, that's all the good work that we're at today as we launch this collaborative. So again, the how, a collaborative that's both about learning and, very importantly, action, using these powerful concepts and tools to change the way we solve problems. We're talking here about a whole of nation imperative. So, we do get caught up sometimes in the video arcade game of whack-a-mole, where we whack one problem down and one mole, and only to find another one comes back up again. So that's the metaphor that most of us feel like we're working in. We're ready for a change. The only thing is, this is not a game. This is real people, real suffering, real national security at stake here. And it's not time. It's time to stop playing whack-a-mole and start a much more comprehensive approach. We've got some help in this, and Health Futures Group has been guided and really adopted, or at least fits with and understands well the concepts put forward by Nickerson and Sanders and the authors of their book on tackling wicked government problems. Subtitles: A Practical Guide for Developing Enterprise Leaders, and leadership at the enterprise level is really what this is going to be about. I want to talk a little bit about the scope and scale, which is really what disruptive innovation is all about. It's jumping to a new scope and a new scale. The scope of our problems, as harvested out of the Wicked Problems book, is that the problems government must address today are increasingly complex, they're cross-jurisdictional and amorphous, and they are just flat out difficult to solve. So-called wicked problems. That's the scope. So it makes everybody want to go home, and we're ready to come back at this again, all right? And the scale, the enterprise, is kind of the term coined to think about the scale that we're talking about. And the enterprise is really, in this construct, refers to the resources and capabilities of public and private organizations that must act in concert to successfully address cross-cutting national and international challenges. Wow, it's a lot there, but that's the scale and scope that we're talking about here. So, and again, it's important that it's public and private, so it's not one or the other. It's not it's not top down, it's not bottom up, it's yes and, it's both. And it's not just local, it's national, it's not just national, it's international. That's the scope and scale. So how do we work at that level? Well, the status quo simply doesn't get us done. So the dissemination approach we have, which is, demonstrate a best practice, publish it, write about it, speak about it, and hope that it's through osmosis and just plain old initiative, it comes out and gets some success. We're not seeing a lot of success with that model at the scope and scale we're talking about. So wicked problems at the enterprise level require a new process for problem solving and solutions. And that really brought us to Roundtable 3 in December, where the Health Futures Group called together a cross-agency, cross-organizational, interprofessional group together, a really robust group, and you were there. Many of you were there for that. The objective was to identify the critical steps to achieve this goal, moving from healthcare to health. In other words, to build health and resilience. That was the objective. The method, aspirational futuring, which has really been vetted and run extremely smoothly at the last few roundtable meetings. You all participated and you know how that's worked. 10 teams worked interspersed between some plenary sessions, and the plan really was to come up with a plan, develop a plan for national health, wellness, and resilience. And this is a mural depicting what happened, how that turned out. And this is captured the final big ideas that Secretary Woodson and other leaders, senior leaders in the room heard. And I think we all walked away feeling energized with these big ideas. So walking through them quickly, what does the community want? That's the aspiration that our community population, our citizens have to get better. We talked about a sense of urgency, and that we all heard many great models that work announced by the President in the State of the Union, and some of the themes that came out of there resonated exactly with where we felt the future should be when we came out of that group. So that's great that the urgency is there. It's time to act. The notion of health GPS, that we need a global positioning system to know where we are. There's an old saying, if you don't know where you're going, any road will get you there. Well, we know where we're going, and we need waypoints and roadmaps to get there. There's unprecedented access to care and access to data that gives us a new opportunity. The notion of a resilience dashboard, so not just a sick dashboard, what's wrong with the patient, but where's the resilience, and moving to green zone resilience was brought up. The research around that, it's a new kind of translational research model that was called for, leveraging what works. And that, pushing to a tipping point where we move from mostly non-resilient communities to mostly resilient communities, a green tipping point toward health, wellness, and prosperity. And you can see communities in action, working with states. When you think of the funding moving in through health policy and partnership for patients and improvement policies and state Medicaid exchanges. There's so many opportunities to leverage that and get to work. But partnering with academia and moving forward. So I take a little time on this because it's so rich with so many big ideas. And finally getting to this idea of a wellness index like our resilience dashboard that focuses on how well we're doing, how to get more of that. Again, we get what we focus on. We get more of what we focus on. So that left us with this emerging vision, an unprecedented scope and scale, and this really is a summary of both Team Hotel and the other leading teams put together their ideas, and again, Secretary Woodson and others, leaders in the room, endorsed and supported these concepts. So establishing a national mission control. Again, we come back to this launching metaphor that I think is very powerful for this work. From that mission control, benchmarks for community resilience will be harvested from high-performing settings across the private-public enterprise on an EPIC campaign for national health, wellness, and resilience. In this process, networks really rise up and form in parallel as communities of solution to replicate best practices among their own constituents. So we know the best practices are out there. It's about replicating them with the aspirations of the communities itself. Comprehensive. It's got to cross all health determinants. It's not good enough to just rescue somebody when they're sick. We want to prevent the need for rescue. It's not good enough to just tutor a child who's failing algebra, but we want the child to be able to learn math and succeed and get into the STEM disciplines and on to college or on to trade school. It's got to be across the enterprise because, again, helping individuals by themselves, we're a caring nation ready to jump in and rescue, but we find too many opportunities to do that, and we're looking at prevention and primary health and wellness across the full enterprise. Individuals, families, communities, and systems, and of course public and private together, working in concert. And this left us with this big vision. By 2020, every community will know the level of resilience for each locally prioritized health determinant and will be engaged with its leaders in achieving resilient green zones of success. It's quite a vision. Let's blast off and go. So Healthy Communities Collaborative for America, really we're talking about launching the breakthrough model for improvement on an EPIC scope and scale. Kind of unprecedented, really. It's time to go to work. So the Whole of Nation Learning Collaborative, what does this collaborative model look like? How does it work? Well, really it achieves health and wellness, resilience through communities of solution. That's the way it's going to have to happen. Again, it's a national strategy with international implications, but it's communities of solution rising up with their own problem solving. That's the key. It's that balance of top down and ground up that come together to make it work. The collaborative improvement model has critical success factors which have been very well vetted and run and proven in system delivering models. So that's really what we want to build on. And again, it's about harvesting lessons from these high-performing communities. Learning and action. It's a process that leads and drives change. So again, learning that things can be better and then supporting the actions necessary to make them better. That combination is powerful. It's about aiming big but starting small with rapid cycle improvement processes. And this is so important. As we know, that kind of an aim big gets us thinking big and starts to think at the national policy level. But it's really hard to fix things at that level, and that's what we've seen. I think we all recognize that. But the big aspiration at the national level with small starts and build up with rapid cycle improvement is a way to get there. We'll talk briefly about the power of aspirational aim statements. As we've said, if you don't know where you're going, any road will get you there. But having an aspiration without a destination, as it said, a dream without a plan is really a hallucination. It's not really a vision. So we want to get there. So this is what a healthy community looks like. So imagine we kind of use trees here to symbolize communities of solution. I'm kind of thinking of the term community trees of a solution, but they really are. These are the models that work for elementary ed. These are the models that work to get people out of homelessness. These are the models that work to keep our seniors active and well in the community, put our veterans to work and not to be homeless, getting those that are addicted into recovery. These are all the communities of solution that are all across the country. And when they're there, we have health, wellness, and resilience, and that is in the green meter. It's in the green zone. It's pegged at the high level. If something happens, if this community is challenged, it faces a stressor, there's so much reserve and so much capacity to reach out and help. That's what we want. That's what the goal is, and that's what the vision of the Healthy Communities Collaborative for America is all about. So with that metaphor of the terrain and the healthy communities growing out of that, how do we cultivate communities of solution? Really, aspiration that something can and should be better is a critical step. So just knowing that it can be, that's such an important message to have. Then you need a safe harbor, a place to envision a future state that allows us to be appropriately self-critical and self-aware of what's not working without worrying about the consequences of that. So the ability to dream safely and to be supported in that. So that's important, and that encourages more aspiration. And then a yes and to build together. Again, we get more of what we focus on, so we want that net forward energy. We want to have yes and to keep the momentum moving. Systemic improvement across all determinants of health. As we mentioned, it just doesn't do us very much good to help a patient with heart failure who then has a stroke from their hypertension, or whose depression leads to suicide. It doesn't do very much good to do job training for our veterans if their addiction issue is out of control and we're not managing that, or if they don't have a place to live. We have to be systemic across determinants. And again, this has to come from ground up. And then we can't afford to wait. The urgency of this is so intense that we just can't afford to wait. We know people are in harm's way. Millions of people are in harm's way. It's sort of that image that they're on the train track and the train's coming, or they're at the intersection without a stoplight and something's going to happen. We have that urgency to fix it, and we've got to accelerate that. And that's what makes the collaborative process so attractive. The aim big, start small concept, I think I've mentioned that, and you're aware of that, and you kind of can understand how that's going to make a difference. So aiming big, it's an aspiration for really achieving this health and resilient state, but starting small, practicing and improving and letting those people who start small and achieve become the champions to spread. Learning sessions with action periods, so it can't be one or the other, it's got to be both. So learning sessions and action periods. And then the environment of that is an all teach, all learn. It's a net forward environment where we just want to get more of what's working. The rapid cycle improvement model is about starting small and improving until it's working. Don't scale up until it works, and when it works, scale up. And usually we start small with the toughest to handle population. And if you can get that population to goal, if you can help that population help themselves, the next group is going to be even easier, and it can be scaled up. The doers become the champion, and they lead scale up. We do have faculty that are national experts, sort of based in the ivory tower, but for every one of those, there's got to be many field faculty, people who come up from the field who understand and know, and they lead the scale-up process. And then once it's perfected, spreading it across the enterprise, and then you've got to. That's the part that this dissemination science is so important. And being able to use this virtual technology and the collaborative improvement process to do that is critical. Again, we don't have time to wait for osmosis, for natural status quo spread. The natural improvement drift is way too slow for the urgency of the work. DNA has been coined as a decide, notice, acknowledge moniker, and it really helps. You decide what you're going to do. That comes from the aspiration. Notice is about measurement and what to do, why it matters, and then acknowledging, both to celebrate success and to reward and honor and incentivize that, yes, but also, by active observing changes that which is observed. So by observing and acknowledging, it gives us, it calls it up and makes it realize that someone else, another community, can aspire to achieve that as well. The rhythm of the collaborative, and again, it's about the learning sessions and action periods. So learning sessions are convening, they're pacing events, come together. Our last roundtable, and I think probably all the roundtables, were really learning sessions to come together. Aspiration happens there, but not just a dream, but a dream that has a visible aim, and maps and tools are either brought forward or called up or asked to be innovated at that learning session. And again, the culture's got to be net forward. It's not a place to come and complain. It's not a place to come and talk about what doesn't work or what can't be or why things are wrong. It's about asking what is not happening and what will it take to get there. And then deciding. Again, the first of our DNA is to decide, and that's commitment to leave in action. So again, no matter what happens at that learning event, if we don't leave in action, then little will change. The action periods happen between learning sessions. It's about staying in action. It's about recommitment. A few of us can commit to something one time and have it happen without some sort of maintenance plan, right? So the action periods are really about that. And again, here's the end for DNA. Notice the progress. Notice what's working, measure it, get it perfected, and then scaling it up. blowing past the barriers. So again, if it's a net forward process, anything in the way just needs to be blown up, frankly, and that allows it to spread. And finally, acknowledge the success for all the reasons we mentioned, because once we know we can do it, others will aspire to do it, and that's what gets it done. So aspiration and then the destination. I'm talking a little bit about the aim statement. So aim statement is really they're measurable outcomes or waypoints on the journey. So it's what the destination looks like and how it starts to guide how to get there. So it states the what is that aspiration, and why is it there? It needs to be grounded in that. That's what motivates us to want to change, to get it done. And of course, how. The GPS, the dashboard, so to speak, will certainly be measured on. The metrics for that will be guided on where we're going, what that vision, what that destination is. So really it's more operational and measurable than a vision. It has the GPS and dashboards, but it's not as prescriptive or specific as a set of objectives, which really bring that down to more of a change package or more of a specific roadmap. And that would be individualized, the objectives to each community of solution, where some of the more GPS-related dashboard elements would be more generalizable. So I've learned to add perspiration through my colleagues at the Health First Futures Group to the aspiration destination, because it's still really just a map until somebody picks up and starts the journey, and that's where the perspiration comes together. And put all that together, you've got a change, and that's what we're looking for. So getting to this national security imperative, building health and resilience, we want to do it now. So this is the aspiration, health, wellness, and resilience. That's what we want to get to. And unfortunately, this is what we have. So we have a system where lifestyle behaviors and health measures are just not at goal, and that leads to high-risk chronic conditions and out of control. And this is a little bit of a medical metaphor, but you can use this for education. You can use this for the criminal justice system. You can use this for the defense health. Not having it work here leads to this. And of course, the dollar signs start to come, and life expectancy starts to fall. Quality of life starts to drop. And of course, it progresses to people that are urgently ill with advanced disease. This is what's breaking the bank. 70% of our healthcare workforce resources and innovation are all being consumed mostly over here. These folks are in trouble. They're suffering now. They're in our rescue care mode now. They're in our ICUs and our specialty care units. They're stored away and warehoused, unfortunately, in end-of-life care facilities, consuming a lot of resources. We also know through epidemiology that these folks will be there soon enough. And just no sooner than we drop off someone here, we pick back another here. And unfortunately, this is escalating. The group here is getting worse. And so we know these folks, too, the walking well, the asymptomatic, will suffer and need rescue soon enough. It's going to happen. So how do we change that? Well, coming back again to this iterative triple focus model of the why, the what, and the how, looking at strategy, operations, and tactics, we've got to think a little bit about how to remedy that. So the why is pretty clear. We have an imperative to build health and resilience now, because a healthy, resilient population is what we want and need and actually require at this time. That's the why. The what is we've got to change this up. We've got to break this cycle of unhealthy lifestyles and behaviors, health measures that are not a goal, and again, apply this to the education system as well. We've got to change that to something that works. How do we do that? What's the how? That's the big question. So getting less of this and a lot more of that is the goal. How do we do that? We really need to change the trajectory and the lives of our citizens and help them do that from the ground up. So resilient communities and a much more accountable care system, we know it works. We have the data to prove that that works, and there are many exemplars around the community, the positive deviants who are achieving that, who we just can't wait any longer to spread. We need to get that out to significantly alter that trajectory. So guided by the positive deviance of health, wellness, and resilience, there are success stories. It's the who, what, and where. It's a second question to run on for you today. The who, what, and where is the aim, destination, insight. Where are people seeing it? Where are they reaching, climbing up? So the rainbow here represents all the disciplines, interprofessional, cross-agency, all the science, technology, and social services, all the things that come together, coming together in networks, climbing the steps to get through net-centric leadership, equality, prosperity, and security to reaching this one state of wholeness of nation. It's out there. And so the key is how do we accelerate the path of people down that journey. Looking at individual and family, it's simple. We want long, meaningful, and productive lives. At the community level, the infrastructure needs to support resilience and a sense of academic wellness. It's a newer term for some of us, but really means that not just that the pedagogical model and the curriculum is up to par in the school, but that every child, every learner shows up to a learning establishment ready to learn, able to process and take advantage of learning, and able to convert that knowledge into a rewarding career. That's academic wellness, and that takes a lot more than the classroom to do that. And then our systems, health outcomes and costs and economic security, that's what we want. So the vision is pretty clear. There are positive deviants. There are exemplars in every one of these categories, setting the curve for the best. How can we run a collaborative that helps the rest catch up with the best? That's the idea. So coming back again to kind of our terra firma terrain model here, looking again at this, you see a thriving community. This is a community of solution tree. So pick your measure, pick your social or health determinant of health, pick those measures, and here they are. So this is an exemplar. It's well, it's strong, it's resilient. This is the healthiest tree in the nation. It's a community tree of solution, pegged on the green zone. So we're lucky to have so many from around the country, and we're fortunate to have a short video to show you, and one of the champions from that community with us on the call today too. So learning from the best. El Reno Community Health Center is a vibrant community health center in Tucson, Arizona, setting the curve. It's a national model for excellence in a variety of categories, and particularly in a story about how they imagined the diabetes care could be better. I want you to listen to this short video. Listen for the three things, the why, the what, and the how. The why is really the aspiration. Where did the aspiration come from? What was that destination? How did that happen? And how did Dr. Sandra Liao turn that into the how? How did it happen? Sandra, thanks so much. I hope it's a short video. The story's amazing, and you could talk about it for a long time. But Sandra's with us, and I appreciate what you're doing and your courage to kind of put your organization out there. Pretty transparent about how well you've been doing and the success. So Sandra, thanks for joining us today. Are you there?
I am. Thank you, Mark.
That's great. I'm going to ask you a couple of questions, and just for your response. And what are you hearing? I know you've had a chance to sit in, even though you're busy in clinic today. You did arrange to get a few minutes to sit and listen to what we've been presenting today. What are you hearing about this Healthy Communities Collaborative for America, the scale we're talking about, that could help El Rio, help an organization like El Rio scale up, both within your organization and then even to spread beyond? We've got to get what you're doing to be the way we do it in the country, and certainly there's opportunities internationally. So what have you heard about this that would help you scale up even more, Sandra?
Well, I really appreciate that you're talking about bringing in so much of the community and talking about all sorts of stakeholders outside of the walls of the health center, which I think is very, very key for the work that we do. So much of the work that we do here is really impacted by, policies that are created by activity, by family and social issues that are going on that, sometimes we can only help so much, but unless we have the support of the community as a whole, it makes it very, very challenging for us to be able to provide the care and then have it be supported and have people be functional once they leave here. And I always see that. I always look at, the individual's patients' experiences, and so much plays into it. Do their employers support them? Does their community support them? Do families support them? Does the law, do the policies that are coming down support them? And without all of that real global view of a patient's experience, it's very, very challenging if we're not really all working together in the same framework to make sure people are, healthy and more functional. And just like the video showed, really having people have success beyond our clinic walls.
That's great. Very, very well said. I appreciate it. And it makes a lot of sense. I mean, I know you've done what you can within the institution, but at some point you do hit barriers that you can't fix with a prescription or community education or any of the other things that you do. I'd also be interested to know, because you were a pretty high-performing organization before you entered the Patient Safety Collaborative, but what have you seen about the collaborative model that kind of helps, again, we talk about this sort of national strategy that the collaborative is running, but really it's a ground-up solution that you've been able to do. So, what are some of the ways in which that collaborative model has helped both your organization, and you're also the chair of the faculty chair of the collaborative, so you've seen many other organizations succeed too. What do you think some of those things are that you've seen work, either examples or just concepts that make a difference?
I think the collaborative model is exceptional at allowing people to really find partners and solutions in other communities that you might have not even been aware of, because you're somewhat isolated where you are, and you start listening to other examples of very good programs, or some funding that they were able to tap into that was something that I wasn't aware about. That's the kind of stuff that I think is really great. It's the all teach, all learn strategy that really helps out. I mean, I learned so much from the collaborative process, but now I'm able to go to other like conferences that don't even involve the collaborative and share with them what we've been doing in the collaborative model. And I think it helps those groups also understand that there is this group of people that are really trying to excel and push some program and gain momentum. The other thing about it that I really appreciate, and I still do, is the fact that we're having this discussion. We're really trying to look for solutions and not just deal with the same problem walking in the door every single day. So having a group of people that are working for a similar goal, and then trying to figure out a positive way to do that, solutions for problems, it's very inspiring, and it keeps me wanting to do the work that I do, because I know that there's people that are trying to figure out what these barriers are for people and try to find ways to overcome that and improve the health of our country. So for those reasons, I think the collaborative model is really wonderful.
Well, you've been instrumental in helping all that happen too. So thank you for your contribution and your role model leadership in that as well. I'm hearing both process, that you definitely take advantage of the process and kind of the national stamp you know, it's somebody else's idea. It's not just Sandra trying to get change. But also, I hear this concept of bringing the joy back to healthcare. So rather than just struggling to see patients fail, actually part of a solution to see them succeed. And, you know, there's not enough hours in the day to do that work. We love that work. So, you know, we just want to do more of that. Does that sound fair? Processes that help and joy in the workplace?
Absolutely. I think that sounds fair.
Awesome. Fantastic. Well, stay with us if you can. I know you may be busy, but there may be folks with questions for you coming up in a few minutes when we wrap up. And thanks again, Sandra, very, very much. I'm sure we haven't heard the last from you on this topic. So look with me now a little bit about what the impact of this is in comparing the green zone resilient communities of solution with way too many much more barren, less fertile areas in the country where communities, for whatever measure you want to look at, are not there. The infrastructure's not there. The communities of solution have dried up and gone away or never grew up to begin with. There's just the sense of resilience is not there. That's the problem. This is what we want to get away. More of this replacing that. That's the idea. So the best and the rest, trying to bring that curve together. So imagine this infrastructure, this sort of terra firma as Health Futures Group, and the collaborative becomes a mission control. So again, I know we're mixing the metaphors of launching to another planet. We're not talking about abandoning our land here and going to another place. We're talking about launching really a ground-up solution across. So I think the metaphors come together nicely when we look at it that way. This community, resilience is strong. This community, resilience is low. And what happens if we begin to pull this model that we're trying to seed that process? Take an acorn, a community of solution acorn, plant it in this community where there's a need. And again, this is not top-down. This is a community calling up, saying we aspire to be this. We don't want to be this anymore. We want to be that. We're asking for a facilitated process to do that. That's what makes this powerful. Plant the seed here. We'll help it grow. We'll roll up our sleeves in doing it. Over time, then, with this concept of sort of providing the infrastructure and supporting communities to grow up, you have a cohort of community of solution trees across the country. This could be one community. This might be 3 states away, another community. This may be down the road in a rural area. Health and resilience, they grow in collaboration and begin to build up. And all we're doing really is talking about replicating the models that work. Of course, as the rest catch up to the best by virtue of being the champion and the teacher will start to get even better. And those resilient zones will get even stronger. And hopefully we're always pushing the envelope on what is the most health and resilience we can achieve. That would be the goal. At fruition, you know, you've replaced a lot of non-resilient communities with a high level of resilience, not by forcing it on them, but having communities aspire and grow up and saying, yes, we see the vision for health and wellness and resilience, and we want to roll up our sleeves and do it. This is where the formal and informal networks come together. Private industry, our units of government, and our military health all come together to do this. Again, once we know we can do this, there's a sense of urgency. People in harm's way, there are patients with chronic diseases who will lose limbs and end up on dialysis and have heart attacks. There's kids who are going to flunk out of school and end up in jail. There's veterans who are going to come home and be homeless, living under a bridge somewhere with their addiction. That's happening. It's happening now. And we can stop it. And knowing that, having the status quo is not good enough, and we can change it. This creates a shared sense of urgency, a clarity of thought and unity of action that we so desperately need with the gridlock and the divide that's going on now. We really need to jump past that, to get out of that exhaust cloud of gridlock into the hopeful aspiration of a rescue mode that's going to work, moving upstream. This is an aspirational aim. It creates new priorities for stakeholders, and we all know when there's an urgent situation, our daily schedule, our budget, our rules about who can do what go out the window. And we begin to think in new models. And there's all sorts of heroes and stories that have been celebrated throughout our time of leadership that rises up in this way. We prioritize differently. We triage what matters. And first things first in an urgent situation is very different than business as usual, right? And that's what we want to be able to do. Again, these informal and formal networks emerge and align around communities of solution to find and share new solutions, moving away from this grind of doing things right so I don't get in trouble, to a new place, aspirational state of doing the right things. That's what we're talking about. So again, with this idea of the Healthy Communities Collaborative for America being mission control, imagine that we've assembled faculty and champions from across the various metrics and measures that are aspiring to be better. Launch multiple collaborative community solutions all in parallel, running together. Network the community, so they're working one with the other, disseminating ground up and system-wide learning. So as, again, the rest are catching up with the best are beginning to really understand what makes them best and even get even better. And
Mark?
of course, iterative improvement. Yes?
Mark, we have a hand raised. I think Colonel Masterson has a couple of comments that he'd like to do. Colonel Masterson, I've just unmuted your phone.
Oh, thank you, Michael. Can people hear me okay?
Yeah, we can hear you. That's great.
Yes, absolutely.
Yeah, Doug and I were sitting here talking about this. I just want to point out to Mark that, when I was growing up, here's another one of our farm stories. When we were growing up, I used to go out surveying with my father, and you could always tell where the septic tank was because the grass was always greener.
That's right.
So sometimes you have to have the right fertilizer to make those communities grow. And
I love that.
I think it's very important to recognize that I like this forum. I think that the discussion that we are trying to get to with the group online is really moving them towards those next steps. And so I just wanted to kind of ask if there are other people out there that in the group that are aware of all the various other initiatives that we're doing at this point.
That would be great, because we're just about to open it up to discussion, and I wanted you and Ahmed to help us do that. So that's very good timing. We're going to blast off here and go. How about that? And jump ahead. So yeah, I'm going to respond to you by just saying what the scale up and spread looks like, moving this through the various metrics here, closing the gap between the best and the rest, and then this is how we would imagine it spreads up, that you really have places, look at things like housing insecurity among veterans, or low graduation rates in college prep, in more of a barren zone versus the green zone where it's happening. And as that begins to move across, we begin to see the field change. So perfect segue, Colonel Masterson. Thanks for setting that up. And I think Ahmed's available too for us. I was going to ask him to react, and then I would definitely like to hear your reaction to the question, and then we want to open it up to the group. So thank you for that segue. Ahmed, are you there with us?
Yeah, I'm on. Can you hear me okay?
Yeah, that's great. Thank you. So really, I want to know a little bit about what you're hearing. I know you're very familiar with this model. You've been a leader in a lot of the concepts between, I think, you and Colonel Masterson. A lot of what we're talking about today, hats off and props to you guys for getting us here. But what have you heard about this that you think will inspire the kind of leadership and action we need across the country, and then let's open it up.
Okay, thank you. So from my perspective, just to give you a situation, I'm sitting in an airport in San Diego on an iPhone, talking through earplugs to you guys, and watching the virtual go-to meeting in my actual iPhone. So my point is, this is very doable with reaching to young people, reaching to all kinds of people who are really interested in communication and sharing their insights and best practices. I think this is very doable. So from my perspective, if we talk about it in models, it feels to me like connecting the PSPC, the Pharmacy Person-Centered Team Care, to the Healthy Weight Collaborative, which has all kinds of good examples of success in terms of connecting to the public health aspects. And I visited the Healthy Weight site here in San Diego and chatted with them. So the notion of combining all these things together adds up to the notion of there are many, many points of excellence throughout the nation. They're just not evenly distributed. The collaborative here allows the possibility of finding those positive deviants and sharing them widely, because in essence we have the NDU convening capacity, we have the MAX as a vehicle for all this, and so what we really have is a grand possibility of replicating essentially what was done in the health disparity collaboratives with the community health centers in particular back then, and a bunch of the IHI activities focused on healthcare, but it's just never been done focused on health as a broader construct. There are many, many family systems and community systems, really excellent points of connection, from the healthy basis at DOD to the work with the VA, the partnerships with patients at CMS, and all of these can be essentially connected up. a summary from my perspective is we have the possibility of connecting the triple aim, the triple focus that you brought up earlier, and the triple learning process. So it's really the what, how, and why combined together in a functional combination, really leveraging both the MAX and collaborate.org and a bunch of the IT exchange possibilities for data, the San Diego Hub, etc. So the point is, there are already pockets of excellence all over the nation. It's just that they haven't had an invitation to share with each other in this way. And so this becomes a platform for having individuals, families, organizations, local partnerships shared widely with each other. I think that's where the communities come into play, and communities of communities, which is really what the Healthy Communities Collaborative for America can be. I mean, all the ingredients are there. It's just that.
Very good. Thank you. Yeah, I hear the combination of the ingredients, the timing couldn't be better, and people's readiness to make things work. So that, Meston, what I know you think about this, live it and breathe it, and where are you at this point? What are you thinking, and how does this seem like it would be the right time to launch something like this?
Okay, thank you, Amit, for those comments, and Mark, thanks for the really nice summary. I think you've synthesized a lot of the work that we've done over the last 6 years. I just kind of wanted to, one of the big things is, and I think that this is why we're doing this initiative, is that we're trying to find novel ways to have dialogue because of the current constraints on the system, and it is very essential that people share the knowledge and then actually move out on doing that, because we're trying to keep this momentum going from when we do have a roundtable to keep the groups together in a way. And so we want the feedback from the people that are participating to see, is this an effective way of doing that? I'm going to just kind of dive in with a couple of things just so that people in the group are aware of. I wanted to thank them for the efforts that they did at the last roundtable, because those efforts have been harvested in crafting a number of things that are currently on the agenda. One is the creation of the National Center for Health Strategies. That is moving ahead very, very quickly. There's a whole series of presentations that we're going to be going to actually where we create the National Center. The other thing is, from the experience of the last roundtable as well as this opportunity, is that we are going to be working with the Innovators Learning Network, which is a collaborative of about 45 different health systems, to include the VA and the DoD, as well as Kaiser and some of the other large health systems, to include also the National Health Service from England. And so how do we, as large systems, learn from each other to actually push that triple loop learning, in the C realm, so to speak, on that 3x3 that we often use to look at strategy, operations, and tactics. And so the meeting will be in May. But again, these are the opportunities, I think. Finally, I think that the other aspect is that we are taking a lot of the stuff that you talked about, Mark, and incorporating that into a new educational platform here at National Defense University that will actually be started in August of this year. So it's a short suspense of crafting a more interactive educational, experiential learning type opportunity to actually have resilience built for the students that attend this, because as those senior leaders start to go out, they start to populate because of the things they learn at a place like National Defense University. And so those are the big three rocks that we're doing, and I think that all come from the construct that the group came up with about creating that Mission Control Center, because there has to be something that orchestrates all these activities in order to produce that net forward momentum that is needed to launch a spacecraft. Out here.
Awesome, thank you. That's fantastic, and covered a lot in a short amount of time there. But the opportunities are rich, the actions are plentiful, and there's so much alignment around the different strategies that you've outlined for us there. And again, I can't thank you enough for giving us the opportunity to get where we are today. So Michael, I know, is helping manage the chat box, and he can see who's raising their hands. So at this point, we have some specific questions here, but you don't have to limit yourself to that. This is an interactive forum. Let's hear it. You got comments, questions? Let's hear it.
Yeah, we've got a question from Robert Tasato. Does the collaborative engage youth in their work, and if so, how?
Yeah, and I think it's a great question. I think it has to, and especially in those that involve young people. I mean, whether it's a pediatric program or an educational model, family health is going to come from kids' nutrition programs. We know kids come home and bring technology. They bring ideas about new ideas about eating, nutrition, health, and lifestyle. Very influential to their parents. So the models that work, I think, are doing that. And again, especially if they involve children and young people. So I think that it's a yes and approach without any barriers or boundaries. And I think that's one of the boundary crossing concepts that the Health Future Groups has brought forward that's really important to this work.
Mark, this is Bat.
Yes.
I think that the other thing that's on is Paul Reed is on. And Paul, do you want to make any comment about HOSA?
Yeah, Paul, if you can raise your hand and Michael can unmute you, that would be sweet.
I think.
You see him? Was he able to stay?
There we go. Paul?
Yes, can you hear me?
Yes.
Yeah, perfect. Thanks.
Oh, great. Yeah, so the question was about HOSA, Future Health Professionals, a national organization of primary school or secondary school and some college level youth who have specific interest in the medical and health related fields. They have been brought into the Federal Health Futures Initiative as of this past year and have participated in a couple of our roundtables and probably participated in a way that was as informative and transformational as any of our participants historically since I've been a part of the initiative. And I say that particularly reflecting on December's meeting and how these young professionals, young and up-and-coming professionals, were able to offer perspective that perhaps none of us would have entertained otherwise, having had a few more years under our belt. And the way I think about that more broadly is if we are really talking about a generational change, a transformational change in our culture, it isn't going to come from decisions or opportunities that we take advantage at our seniority. It's going to come from the youth growing up and sharing that new culture with their families. So, and doing it so from a social and community standpoint as well as from a professional standpoint. So we've seen that. It's going to keep informing the process. And I have a feeling the question that Rob Tasato posed regarding engaging youth is as much related to the answer that you just gave, Mark, as it is related to fostering and cultivating that transformational change in the next generation, which is really where all of this is ultimately going to end up.
I hear a lot of hope there, which I think is great. And I think that idea of it's probably, if you look at an epidemic, to sort of turn the tide, we've got maybe a couple of decades of existing chronic disease pathology to kind of live through and optimize, but at some point we've got to stop that from happening. So I think that's well said. It's not.
Mark, can I jump in for a second? Samit?
Yeah.
So I have a slightly similar feel, but a couple different words for that. So I think the young people can bring crowdsourcing that came up at the December roundtable, and it was fascinating to watch a young person actually get into an interesting open-air discussion with one of the generals, right, about the notion of crowdsourcing and the notion of bringing modern, essentially social media combinations to bear here. So the answer from my perspective is the youth is invited, and we have absolutely no idea what they're going to arrive with. In a sense, it feels to me like sort of inviting Silicon Valley, and they come in with gadgets, or inviting any number of communities in the middle of the country that have been working on different aspects of all this. The point is that launching the collaborative is essentially the notion of launching a platform with mission control kind of connectivity so that anybody who wants to jump in can jump in and share some of their insights.
Very good. Thank you.
Now, I think we had we have a couple of questions. One, I think Kathy Baldwin, did you, I think maybe you may have had a question, Kathy.
Hi. Sure. Hi. Thank you for the opportunity. My name is Kathy Baldwin, and I have worked with Dr. Calvo and Dr. Loafman for quite a few years in both the Health Disparities Collaborative and now the Patient Safety and Pharmacy Collaborative. I actually was going to share very much what was already just moments ago shared regarding I had the pleasure at the December meeting of sitting with several of the students who are the future health professionals that we are talking about. But I also want to put a plug in that, you know, we're doing that in our Patient Safety and Pharmacy Collaborative. We involve the various schools of pharmacy who find this extremely rewarding, and it's a great way to engage and, you know, just facilitate and get out there and touch more lives. So it is a strong system to build on. But also, if we go even younger, if we think about our Healthy Start program, I mean, they use the collaborative model. I was asked to speak at one of their meetings, and I was pleased to see that, you know, the Healthy Start, the federal program that really promotes the school readiness of children, really is using that collaborative model for social and emotional development and to train the trainer, if you will, the folks that are out there working with those students. So I think there's an opportunity to start talking health from birth, if you will.
Very nice. And that covers the concepts. I really was struck by the reminder about the student learning process, too. And I think that one of the things we've seen so much through the collaborative is that the students, not only by doing this work, they get to learn the aspirational way to do it, but they're also part of the workforce solving the problem. So you kind of change students from kind of a workflow downer who takes time away from the workflow to actually a care manager, almost a workflow augmenter who comes in, and part of their job is to learn by doing, which is great. So I love that connection.
Yeah, and Mark, we got another question. I know we're running out of time here, but we've got a few more minutes. This is from Jay Flotman. This is a great exercise in mental modeling and collaboration of experts. And what we've talked about most is the change in lifestyle that leads to chronic conditions, disease processes, and so forth. El Rio cracked the nut by incorporating these lifestyle practices into their practice, and results happened. How is the Health Futures Roundtable Collaborative impacting the individual? It seems to me that Dr. Leal worked with one person at a time, and that's what made all the difference. As Dr. Loafman suggested, it has to work from the bottom up rather than the top down.
Yeah, Jay, thank you. Jay was on Team Hotel, so he was instrumental in helping us craft the winning aim statement. So, Jay, thanks for joining in, and thanks for all your hard work so far. So, yeah, I think you said it well. It's partly a statement, partly a question, but I think Sandra Leal and El Rio showing that a national strategy deployed in a way that works from the ground up is what it's the good combination. It's the sweet spot between top down and ground up to make things work. So the Healthy Communities Collaborative for America proposes to facilitate the scale and scope that we do that same work on, and I think that's well said, Jay. Thank you.
And I believe that's all the questions we have and all the time we have for today.
We'll jump ahead and just to wrap up. We're almost out, guys, so hang with us here. The systems that we have are pretty much perfectly designed to get the results we get now, which aren't good enough. Wicked problems require a different kind of change, a transformative change, of collaborative models proven to work. One overarching process with many communities of solution in parallel action. Whole of nation, enterprise-wide. That's the goal. Michael's going to talk a little bit about resources, where you can find them, what the next steps is, and the next webinar. So we leave this webinar in action for the next time. Michael?
Very quickly, on Max and in maxhealth.us/collab, which is the debate graph, you'll be able to get information, participate, interact. You'll get notifications of upcoming webinars, you can always contact me at michael@mwknowles.com. That's on the invitations, by the way. We're going to be doing the next webinar towards the end of the month, very much more action-oriented. We wanted to get you set up, give you the information, present the concept to you. This is a massively parallel, networked set of communities of solution that we're really working towards, which gets to the one and the many. I want to thank everyone for attending today. Again, if you have questions, you can send me an email. I'm happy to help. We'll get you into Max if you're not already, and I believe most of you already are. Be well, and talk to you again from the Health Futures Group at National Defense University.